Progressive mental disease which slowly but surely destroys mental functions. Doctors worldwide note it as the most common cause of dementia, that's brain disorders that cause a loss of cognitive and social skills. Alzheimer's causes the brain cells to degenerate and die, thereby reducing the capacity of the brain to process information. It usually affects people over the age of 60. In the beginning, a person with Alzheimer's may just appear confused or dazed and have trouble remembering simple yet everyday things like say the name of an object, where they kept their house keys, or even where they live. As the disease progresses, the victims have trouble organizing their thoughts and start forgetting names of even those close to them. Multitasking becomes even difficult and the ability to concentrate is almost completely lost. Eventually, they reach a point where basic functionality is a step too far and then their personality begins to change. Since they're not able to do simple things like add numbers, cook food, or name objects, they may become grumpy and morose. He or she will eventually stop taking part in conversations and be embarrassed about their forgetfulness. This damage initially appears to take place in the hippocampus, the part of the brain essential in forming memories. We all know that neurons transmit messages to different parts of the brain. As neurons die and degenerate, additional parts of the brain are affected. By the final stage of Alzheimer's, the damage is widespread and the brain tissue has shrunk significantly. Patients with Alzheimer's get bouts of depression, social withdrawal, and mood swings. They may also develop a deep distrust of other people, become aggressive, delusional, that is, of the belief that they have been wronged in some way and completely change their sleeping habits. Most doctors believe that Alzheimer's is caused by a combination of genetic, lifestyle, and environmental factors. Less than 5% of the time, Alzheimer's is caused by a specific genetic change that guarantees a person will develop the disease. The greater risk factor seems to be the aging process itself. Doctors note that the chances of developing Alzheimer's increases greatly post the age of 60. These chances more than double after the age of 65. The chances of developing Alzheimer's appears even higher if a first-degree relative, that's a parent or a sibling, has the disease. Women are most likely to have Alzheimer's than men as they tend to live a longer life. People who have suffered from severe head trauma are also at a greater risk of developing this degenerative condition. While there is no definite preventive factor, doctors around the world agree on the fact that Alzheimer's may be prevented by leading a healthy, mentally stimulating lifestyle. Regular exercise, regulating blood pressure and cholesterol, consuming a diet that includes fruits and vegetables, and taking part in activities that require mental and social stimulation may prevent the onset of the condition. Since it is a disease related to the brain and mostly genetic in nature, even the most thorough research has shed very little light on this disease. What most people do agree on this is that the person suffering from Alzheimer's will eventually require 24/7 care and a lot of patience from his or her loved ones. It is recommended that if you do observe some of the aforementioned symptoms in an aged loved one, you should visit the doctor as soon as possible.